take a seat. What time was your appointment today? All right, and can you confirm your first and last name for me? All right, perfect. Well, welcome to the OBGYN clinic. Is this your first time here? I kind of figured you do look a little bit nervous, but that's okay. I was the exact same way when I was in your shoes, let me tell you. All right, so it looks like we have you on today for a GYN problem visit. Is there a concern that you have going on today? You've kind of felt irritated down there? Okay. And how long has that been going on for? About a few days? Okay. Now, when you say irritated, is it like a burning, a stinging, a itchy? Okay. So a little bit of, quite a bit of itchiness. Okay. You just feel like it also burns when you itch. Okay. Now, have you taken a look down there at all? Do you see any new moles or lesions or anything concerning like that? No, but you're pretty scared. Okay. No, I completely understand. I take it this is the first time something like this has happened? Okay. Understood. Okay. Have you noticed like any discharge at all? Yeah, like any type of fluid that's kind of in your underwear from your vaginal area. Kind of like a white clumpiness. Okay. Yeah, no, I totally get that. Are you having any urinary symptoms at all today? Going to the bathroom more, burning when you pee, urinary urgency? You're good there. Okay. So, I know this, you're already nervous and this is probably going to be very uncomfortable, but I do just have to ask you a few questions if that's okay with you. All right. Have you ever been pregnant before? And when was the first day of your last menstrual period? Okay. Gotcha. Now, are you on any medications right now to manage any health conditions that you have? Okay. And then any surgeries at all? Okay. And do you smoke or drink at all? Okay, so no tobacco or marijuana use? Okay. Any family history of breast, ovarian, uterine, or vulvar cancer? All right. And are you sexually active at all? No. Never been sexually active before. Okay. Okay. Now, lately, have you used, can you think of anything new? Have you used any new underwear, body washes, soaps? Okay. All right. Very good. Okay. So I put all the general information in. So let's get a chart started for you here. I think I have my pen underneath this, so don't mind me. So I am actually just going to be taking your vital signs, like your blood pressure and your temperature check. And I'm just going to kind of figure out with you, what your goals are for today. And as far as an exam, kind of what you will allow and what you won't, especially considering you haven't been sexually active before. So how about we just start simple with some blood pressure reading. So let me go here. I am just going to put some hand sanitizer on. this is just gonna go right around your arm there. Very good. I'm just gonna secure this here. Just make sure it's nice and tight. Does that feel secure? Okay. I'm gonna take a quick listen. Just your feet are already flat on the floor, so if you could just keep it like that. Give me 1 second. Okay. Blood pressure is a little bit high, but I know you're super anxious. Have you ever had blood pressure issues before? Okay, just want to make sure. You can slide your arm out of there for me. There you go. All right, let me just wrap this around here. We're done with the blood pressure. Alright, going to close that up. Let me just write your blood pressure down here. Do you know roughly how tall you are? Okay. What about weight? Alright, awesome. Let me put this away over here. And then we are just going to get a temperature reading. Now for the temperature reading, this is actually sublingual, so the thermometer is just going to go underneath your tongue. Sorry, I had a brain fart. Okay. Alrighty. Alright, this is just gonna go underneath your tongue there. Alright, your temperature is normal. So that is awesome. Alrighty, so let me put this over here. Let me put some more sanitizer. Just in case, I just want to collect a urine sample from you. So I'm just going to label a cup with your name on it in the event that we ever need it to send it out for anything after you see Leanna the PA. Okay, so before I forget, let me set that up here. I'm just gonna put your name underneath here. Basically, take the lid off, you pee in the cup, close the lid, and you can bring it back in here, okay? Awesome. So, now coming in for vulvar or vaginal irritation in a new discharge can actually be super common. It's one of the most common reasons people your age come into the OBGYN clinic. And oftentimes what people don't realize is there are really common vaginal infections like bacterial vaginosis and yeast infections that can happen in people who are not or have never been sexually active. And so it sounds like, you know, one of those may be the case for you given all the itchiness and irritation and the thick discharge. So normally the most thorough exam is for us to perform a pelvic exam where we take a look on the outside. We use a speculum, which is this device here, to look inside of the vagina so that we can see the discharge, see the inflammation, make sure there's no foreign bodies, etc. And then an exam, usually Leanna will insert her gloved finger to make sure she doesn't know any tenderness or masses. Now, in individuals or patients who have not been sexually active, you know, we are not here to scare you into never coming back here again or to force you to do something that you aren't comfortable with. So the goal essentially is just to identify what you're okay with us doing and what you're not. One option we do have in the event that you absolutely do not want a pelvic exam, or at least an internal pelvic exam, is Leanna, the PA, can just look on the outside, and then she'll take a vaginal swab. It's about the size of a Q-tip, and she'll show you. And she basically will insert it vaginally just to collect the sample and be able to send it out to lab. And oftentimes, based off your symptoms and the way you're describing the discharge, she will treat you kind of prophylactically while we wait for those test results. You're okay with her looking on the outside, but you absolutely do not want a speculum. That is okay. And no manual exam with the gloved finger, I take it. Okay. That is not a problem at all. I will definitely let her know, and then she'll come in, she'll talk to you, hopefully figure out a diagnosis for you as to what's going on, and then we'll send you on your way. Absolutely. So I left this drape for you on the medical table right over there. Everything top-wise can stay on. You'll just get undressed from waist down, and like I said, I will tell her absolutely nothing inserted vaginally. We're just looking on the outside and then using Q-tip only. Awesome. All right. Well, I'm going to give you some privacy. You can leave that urine sample. Then Leanna, the PA, will be in for the exam portion. No problem at all. It was nice to meet you. Hello. It is very nice to meet you. My name is Leanna, and I'm the PA that will be doing your exam today. Lee, the medical assistant, was just telling me that you've been having like a thick, white, clumpy discharge with a lot of outside irritation and itchiness for the past few days. All right. She was also telling me that today we will not be doing a speculum exam, but you are okay if I take a look on the outside and if we insert a swab vaginally just to screen for BV and yeast. Okay. Just making sure. Now, I do want you to know that there is another option where I can allow you just to swab yourself if you would prefer, in the event that you really just don't want me looking down there or you're not comfortable with me inserting the swab. Would you prefer to self-swab, or would you prefer that I do it? You're fine if I do that? Okay, awesome. So basically then, I'm just going to take this light here and we're just going to take a look on the outside. I'll make sure I don't see any suspicious bumps or lesions or anything like that. And then I will let you know. I'll show you the size of the Q-tip. We'll get that going, and then we're not going to be doing a manual exam, and of course not the speculum exam. Not a problem at all. All right. Do you have absolutely any questions at all before we get started? You think you're good? Okay. And of course, if at any point you change your mind or you're just super, super uncomfortable, please just let me know, and then we'll try to find a way around it, okay? Awesome. All right, so what's going to happen here is I'm going to ask you, this is what people always joke about at the OBGYNs. I'm going to ask you if you could keep scooting all the way to the edge here till you feel like your butt is hanging off a little bit. Keep scooting, keep scooting. Good there. Awesome. It may feel like you're falling off. I promise you're okay. Then we are going to take this light here. And so I am just going to start by doing an exam on the outside. So you'll feel my gloves here. I'm sorry if this is irritating you at all or pretty tender. You do look a bit red and swollen. But I'm not seeing any suspicious moles or any suspicious lesions, which is good. Have you had like these breakouts anywhere else in your body or just your vulva area? Okay. Any recent swimming at all? Okay. Okay, almost done here with the exam. External exam is completed. So this is what we call a vaginitis swab. And so I'm going to take out the swab here. So basically, this swab is going to collect a specimen that will screen for bacterial vaginosis, a yeast infection, as well as trichomonas. That is the size of the vaginal swab that we are going to be using. Is that okay with you? Okay, just want to make sure. So you will feel my gloves on the outside here. You're going to feel maybe a little bit of pressure from that Q-tip there. We are almost done. I do see a little bit of that discharge. So I definitely think that what you have going on today is probably a yeast infection, and you've never had one of those before? Gotcha. All right, swab is out. We're going to get that collected here. And we will send this out to the lab. I'm just going to give you a little pat down just at the bottom here. Okay, awesome. So you are all done with that exam. I'm going to cover you up here. So yeah, like I was saying, it looks like you have a really common vaginal infection called a yeast infection. And what I always tell people is you can have yeast infections and BV infections without ever being sexually active. So I don't want this to make you panic that you got something maybe from somebody else or something like that, because they are super common. Sometimes they could be related to our blood sugar levels. If you recently went swimming and you were in your swimsuit while it was wet for a long period of time, sometimes, you know, certain soaps or washes can cause yeast infections. And so something recently probably irritated you a little bit. And so oftentimes with yeast, I usually tell people if there's a lot of itching, a white clumpy discharge, typically odorless, you're looking more so at symptoms of a yeast infection versus BV or bacterial vaginosis, which is a pH imbalance. This tends to have a very strong odor rather than be odorless, and it tends to be a bit thinner than yeast, and usually there's no itchiness with it. So the good news about yeast infections is they are very, very easy to treat. You literally take one pill of diflucan and that should completely clear it for you, although you may notice symptom improvement within the next few days. Now, of course, if you don't notice any symptom improvement, then you just want to let me know. But like I said, super, super common, definitely can be so irritating down there and definitely bug us a lot. So it's good that you came in. I actually have some diflucan pills here at the little pharmacy that we have. So let me grab you one of those. So I am going to leave one tablet here for you. Lee, the medical assistant, will come bring you some water. You just take the tablet and then you should be all set. But do you have absolutely any questions for me at all? You're okay? Everything makes sense? Awesome. Very good. Well, I am going to give you some privacy then to get dressed again. I'm going to let Lee, the medical assistant, know I gave you a tablet of the diflucan, so she'll come in and bring you some water. And then the girls will see you at checkout. They'll give you some patient education regarding yeast infections. And of course, if you have any questions, concerns, or you feel like the symptoms have not improved, then definitely let me know, okay? Absolutely. Absolutely. And then if anything else shows up on that swab, of course, I'll be giving you a call. For sure, for sure. Well, it was very nice meeting you. Please know we are always here for you, and definitely come back if any other concerns. Absolutely. All right, I'll see you later.